have a really robust testing program here in the city of Milwaukee and throughout Milwaukee County. And I want to once again thank the county executive for that. The partnership with the state has been very critical, and Governor Evers in particular and his staff have stepped forward and made certain that we can continue the staffing. We are continuing the transition from the National Guard to City of Milwaukee employees, in particular at the Miller Park site. We still have the National Guard, which has a presence there because it's the location that's basically the hub for this entire region. But most of the work now is being done by City of Milwaukee employees. And that will continue, and we anticipate that by Thanksgiving, it will be all done by local employees. So we appreciate that. And once again, we love the partnership we have with the county on this as well. As a result of that, the demand continues high. Yes, just yesterday at Miller Park, we had 1,987 people being tested. That's actually a little lower than we saw earlier in the week, but that's okay. They're working very, very hard. We saw a very healthy number at the Northwest Health Center, where we had 725 individuals. On the South Side Health Center, we saw 442 individuals. And South Shore in South Milwaukee, we saw 490. So Milwaukee County, the community testing, the total this week is well over 10,747. And as we've talked about before, we have been able to adjust schedules, and so that we can have Saturday testing, which will begin at Miller Park starting this week, November 21st, from 9 a.m. to 3 p.m. So that will begin this weekend. And again, we love the partnerships that we have that are allowing us to do that. The Brewers have been wonderful to work with. They really, really, I think, understand the importance of this to the entire community. So my hats off to the Milwaukee Brewers as well. A word of caution, of course, is we all know that this funding through the CARES Act goes through the end of the year. We have had conversations with the state about continuing it, how we would finance that. Those are still pretty much in the embryonic stage as to how we would continue to finance those sites. But as we've said on many other calls, we still need to have the federal government step forward for testing, for tracing, so that we can have those federal dollars there. And we will need the legislature to work with the governor. And I think the governor in good faith has been trying to work with the legislature. And so I'm hoping that they can work something out so that all of our mutual constituents can benefit from this, because it's not just a City of Milwaukee issue or a Milwaukee County issue. And as we all know, and if there's anything we've learned from this is something that permeates our society. It started out here in southeastern Wisconsin, but we know the numbers now in other parts of the state are in many ways much more serious than they are here in the southeastern part of the state. So we clearly need to have a bipartisan approach to this. And that's something that I hope that we can achieve. I can't say sooner rather than later, because it's later, much later than it should have happened, but I still think it's possible to have that happen. With Thanksgiving coming up next Thursday, this is going to be a critical day. And I think from the Center of Disease Control to the State Department of Health to Dr. Weston and others, the words of caution have been hurled vociferously for people to change their Thanksgiving plans from the traditional Thanksgiving. I can tell you here at our Baird home on the west side of Milwaukee, where we traditionally have well over 20 people, we might have 3 or 4 people. And our big challenge, this will show you what an athletic family I come from. Our big athletic event on Thanksgiving is a gigantic rock, paper, scissors tournament. And so my wife has been trying to figure out how we can have a rock, paper, scissors tournament with 26 people over Zoom. So if anybody knows the answer to that, please inform my office so we can figure out how to do that. But that tells you how seriously we take it, because we all want to be with our loved ones on Thanksgiving, and we all want to be with people that we feel most comfortable with. But as we've seen time and time and time again, oftentimes that is the most dangerous situation, because that's when we let our guard down. And whether it's a wedding or a funeral, we have seen just the numbers and the stories which make you shiver, because they're so sad when you read about a wedding party that then resulted in literally dozens of people being infected. We don't want that to happen. We're concerned about what's going to happen on Thanksgiving. We're concerned about kids going back to school after Thanksgiving. If their parents have had large gatherings at their homes, and what's that going to do throughout the community? So it's a very serious time. And I think that to really put exclamation point on how serious this is. Later on in our program today, you'll hear from Tim Cegelski, who's the Director of Integrated Content at Marquette University. And I'm so grateful that he is well and has made the decision to join us here today to talk about his experience in recovering from COVID-19. But as we know, not every COVID-19 story ends so positively. So when you hear about the rise in cases, when you remember that real people are getting sick. And again, when you hear Dr. Weston talk about what's happening in our hospital, we all have to take this seriously so that we can just make it to this vaccination period and everybody gets the vaccine. So with that, I'm going to turn it over to the County Executive Crowley.
Thank you, Mayor Baird, and again, thank you for your leadership. So today I want to start off mentioning the facility-wide COVID testing that we recently conducted at our House of Corrections. And so I want folks to know that we definitely take the health and safety of all the individuals in our care extremely seriously. There were more than 1,000 tests administered over the course of last week, Thursday and Friday. And of those tests, we had new COVID-19 positive cases, and they include 9 House of correctional staff members, and 53 individuals in our care. These case numbers are just the positive cases from the testing that was done at the end of last week. And so we're still trying to track the source of the infections, but we want to be as transparent as possible with the information that we currently have. But Milwaukee County does update our COVID testing dashboard each week with the results of the individuals in our care and staff at congregate living facilities. And our goal is, again, to be as transparent as possible with the information for our community. This information is available to the public at county.milwaukee.gov. And we're also using this data to make many different decisions. And so based on what we know now, we'll be immediately implementing changes to prevent this level of spread. And changes include more frequent testing of staff members. We'll begin testing staff every 2 weeks after Thanksgiving. We're going to enhance our contact tracing in congregate living facilities. We're going to have stricter health screenings for all in-person employees and contractors, stricter transfer protocols, HVAC enhancements in the House of Corrections, and additional disinfecting efforts. And meetings between people in custody and external staff will either be via telemeeting or will be in a space that allows for physical distancing. We'll be doing what we can to minimize this spread and to ensure that all the individuals in our care and our staff stay safe and healthy. And again, just to echo Mayor Baird, I want to thank our guest today, Tim, as well. You know, him and his family and children all tested positive for COVID-19 and now have their paths to recovery. And his story is compelling and is one of thousands in Milwaukee County right now. And so with more than 58,000 confirmed COVID cases in the county, that's nearly enough people to fill both Miller Park and the Fiserv Forum. I want to repeat that. Enough people to fill both Miller Park and the Fiserv Forum. And so sometimes we have to remind ourselves that the numbers that we're seeing represent real people and real families. For each person who tests positive, there are physically, emotional, and there are financial impacts. And these impacts go beyond the person who tests positive. It touches their families, their neighbors, their workplaces, and even more. And so his story and the many stories like it are what we need to keep in mind when deciding how to spend our holidays or how to respond to a party invitation. And with that, I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we've had 58,928 confirmed cases of COVID-19 in our community and 604 individuals who have died. We continue to see worsening trends in cases, in hospitalizations, and in deaths at the county and the state level. Trends and trajectories that suggest the need to tighten up our efforts, modify our individual behaviors to ensure that our health systems can maintain services and our community can minimize the impact of this disease. I've heard a few questions come up again and again, so they are certainly on people's minds, and they're excellent questions, so I want to take a few minutes to talk about them here. First, as we approach Thanksgiving, there's questions about quarantines. I really want to see my family, or I have an elderly family member, and I don't want them to be alone for Thanksgiving. Can we quarantine for 14 days and then get together? This is cautious, maybe. If you are indeed able to keep a strict quarantine for 14 days, this could be safe. However, keeping a strict quarantine is extremely challenging. It means not going to work where others are present. It means no children going to school, no restaurants, coffee shops, bars, no haircuts. Each of these activities has become far more risky today than they were several weeks or several months ago. The level of disease in the community and the likelihood that you come into close contact with someone transmitting COVID has reached higher levels than ever before and continues to climb. Now, the challenge with these sort of quarantines also is that not only are they very difficult to truly achieve, but if you think of them like a bubble, you only need one small hole and they can easily pop. One outing to a restaurant, one child going to school, one unsafe gathering with a neighbor can lead to a very unsafe situation for everyone involved. Instead, I would encourage you feel empowered to avoid Thanksgiving gatherings this year. You can still gather virtually. You can spend time distanced in a small group around a fire for a short period because it's going to be cold. You can deliver a meal to a family member or really just call and tell someone why you're thankful for them. And by doing any of those things, you can make sure that your family stays healthy, that they can be there for birthdays, for dinners, and for Thanksgiving that we can all look forward to next year. And I can tell you the Weston household Thanksgiving, it's been pared down. The initial plans, we were going to do a distanced gathering of some sort with family, but we're going to just keep it safe. We'll be within those in our household, and we'll connect with others virtually. It'll be different, but I think it'll still be special. To the second question, there has been a lot about immunity. So if I was diagnosed with COVID last month, am I now immune? Do I no longer need to take precautions? Unfortunately, this is one of the big unknowns with COVID. There are a few unknowns, and this is certainly one of them. It's unknown both how long any sort of immunity may last, as well as who gets that immunity. Does it depend on your immune system or how sick you become or how large a dose of virus you're exposed to? We'll certainly know more about this in the future, but for now, all bets are off. It's safest by far and certainly recommended that you continue to physically distance, to wear a mask, and to take general precautions regardless of whether you've had COVID in the past. Finally, there's a question of personal liberties. This comes up a lot. It's often phrased something along the lines of, why should I be forced to wear a mask or to physically distance if I don't want to? Why should my freedoms be infringed upon? So this is certainly a discussion that delves into personal choices and personal values. I would say that you could consider some parallels in a lot of areas, one of which is the restrictions that are in place when you drive a car. You must wear a seatbelt. You must drive a certain speed limit. You must go in the right direction down the street. And there's many more examples. And each of those are in place to protect you as well as those around you. And each of those layers of protection greatly decrease the number of car crashes and the resultant injuries and deaths that we see each year. There are times when small sacrifices are reasonable to protect ourselves and to protect the public. Shortly, we're going to hear from Tim. He'll tell you his story of his battle with COVID. I think his story is unique in that he's an eloquent speaker and he tells it in a very powerful way. But unfortunately, he's not unique in his suffering from COVID. His story is a reminder that the effects of COVID go well beyond the death rates we see and the hospitalization rates we hear of. It's about people suffering, often for long periods and often from states of initially very good health. I'm so glad he's doing better, and I'm pleased that he's chosen to share his story today. Thank you and stay safe, and I'll hand it off to Health Director Rausch.
Thank you very much, Dr. Weston. Some great messaging today, and I hope to share similar messaging with the data for today. So welcome everyone. My name is Darren Rausch from the Greenfield Health Department. And I want to start today talking about some of the overarching issues that we've seen in the data and will be supported by the data I share today. But at the risk of sounding like a broken record, the top two comments that I will mention have been repeated for several weeks. Number one, we continue to see sharply increasing trajectory of disease over the past several weeks. We continue to set new record highs for 7-day averages in both the city of Milwaukee as well in the suburban communities. And secondly, we continue to track several indicators that are really pointing to the seriousness and the advancing seriousness of the COVID pandemic. We've noted for a couple weeks that hospitalization rates have been ticking up. We've noted as well that hospitalization rates amongst our more elderly, medically fragile individuals in our community have been going up as well. Additionally, we note again this week a significant increase in deaths in our community, particularly in our suburban community, and that's something that's alarming. One of the new things that I want to share today, because it's a new report that we recently finished, is our social determinants of health report, looking at social issues in our community that often negatively impact the outcomes in our community, our health outcomes. Social determinants of health are conditions in the environments in which we live, work, and play that affect a wide range of health, functioning, and quality of life outcomes and risks. And we've continued to see these conditions contribute negatively to COVID-19 outcomes from the early days of the pandemic, both within Milwaukee County as well as across the country. And there's a lot of important data to highlight in this report. I'm just going to touch upon a couple things. And one of the key things I want to mention is that when we look at this data, we need to remember that there have been certain trends within our data in Milwaukee County for the pandemic. We know the first wave of cases was had heavily impacted the central city of Milwaukee and our African American community. We know a second wave largely impacted our Hispanic Latinx community. And we've known recent illness has really hit our white suburban population and those who are between the ages of 25 and 59. So keeping those things in mind, let's take a look at some of the data that really underscores some of those social determinants that are working against us sometimes when it comes to our health. Here I'll note on this figure, this is looking at 14-day incidence rates, so rates of new cases of COVID-19 by race and ethnicity group. And while I've highlighted in the past that the white population has the most cases, we continue to see the highest impact in terms of COVID disease rate in our Hispanic and Latinx populations. And we see that markedly throughout the first several months of the pandemic. And more recently, we seem to be coming together a little bit in those racial and ethnic groups. Again, underscoring the additional risk placed on some of our population groups. This figure is the same, looking at 14-day incidence of COVID by social vulnerability. Social vulnerability is an index that ranks from low to high those who are most socially vulnerable in our community. Social vulnerability index includes things like socioeconomic status. And in this graphic, we see a very marked high rate of COVID amongst those who are most socially vulnerable. And we'll see that again in a couple other slides, because these social determinants of health do tend to align with each other quite consistently. In this figure, we look at household income, and we see a very similar pattern as the previous slide on social vulnerability. We see that the lowest median household income populations had the highest rates of COVID, particularly in the early months, and that has continued a little bit, but as we've gone farther in the outbreak, every median income group has been affected. And then lastly, if we look at the percentage of workers in essential occupations, we know early on when we were safer at home throughout Wisconsin, those workers and those employees who were in essential classifications had a preponderance of disease and had very, very high rates of disease in the early months, and that has since kind of gone away over the last few months. These trends are similar for both hospitalizations and deaths as well, and I'm happy to share the full report through Sydney after the media briefing for others. But it's really important to underscore and continue to acknowledge that social determinants are those factors that have deleterious effects on our health as well. So shifting gears a little bit to talk about the weekly data, the graphs on the screen here look at daily cases of COVID-19 in our 18 and under population at the top and 17 and under population on the bottom. And again, I just want to show you that the trends continue to climb. We continue to get higher and higher and higher rates. I will point out for this, both this graph and the data I'll show you in the whole county report, is that the data, it's not necessarily data quality, but the data timeliness has been significantly impacted by very high rates of testing. We are seeing test results coming back at a much slower rate than they have been earlier in the pandemic. So we have appropriately marked the last 7 days on these reports as preliminary data so that we don't give a false sense that the data is deep, because this data is very, very preliminary as we look at the last few days. So shifting to our whole population report, you see here, we continue to climb. The city of Milwaukee is currently experiencing just around 650 cases on average over the last 7 days. And in the suburban communities, we're looking at about 450 cases on average over the last 7 days. I will note that each of those numbers is an increase of about 100 over where we were last week. So we continue to see very, very high rates of disease. And we're seeing that statewide as well, because we know yesterday the state had some of the highest case numbers they've reported in recent weeks and are currently averaging nearly 6,600 cases per day. The last report, or the last chunk of data I'll share today, is just looking at testing and testing coverage. We continue to monitor this data. We are very proud that we're seeing increased testing success and people uptaking that testing. We know the most recent data is pending, and again, to underscore how that pending preliminary data impacts us, when we plot that data down here in the bottom right in the 14-day trend, it looks like our rate of cases is going down. And we believe that to be an anomaly because the data is not complete. So really the key today is that the data continues to climb, and we need to continue to do everything that we can, both ourselves and our families, to keep us safe.